Okay, so we're not afraid of supervision.
Okay, another question here.
There are reports in some counties that are recruiting. Others have said, okay, we have the money. If you don't come, we'll get more other people.
Yes.
Others have threatened. If you don't show up, we'll sack you. What's your reaction to this?
We don't have a problem being sacked because you'd rather be jobless than work under a facility that has no structures. Okay? We're not afraid of being sacked. We're not afraid of them advertising for our jobs. Okay? I mean, when you advertise for my job, then it means you don't need me. And if you didn't need me, then you would not even be devolving me in the first place. Right? So if they're going to advertise for, I mean, the Constitution allows them. Let them go forward and do it. What I would like to know is exactly who is this they're hiring. Look at doctors, for instance. We're only 5,000 in this country. We're not even enough for the population. Okay? Of this 5,000, more than 3,000 are in private sector, because they have no interest whatsoever in working for the public sector because of all these kinds of problems that the health sector has always put in the way. So the same way you're going to fire, the same one you're still going to advertise and expect them to apply for this job. Majority of senior doctors in this country have established private practices, are only based in a few urban centers, and I don't blame them. After years of struggle, you have tried to do the best you can, and the working conditions have proved impossible. You still have a family to feed, you still have responsibilities to uphold. You have to make the choice which way to go. And the young generation is coming up and trying to say no, no, no. At the end of the day, the private sector doctor only serves how much? 10% of the population. The remaining 90% is still supposed to be served by the doctor in the public sector. So should we keep running away, or should we at least stop and try and make a change and really serve the person who needs the healthcare? Because if you look at these people who are making these high-profile government people making the decisions on healthcare workers, all of them are treated in private practice. All of them has medical insurance that allows them to be treated even outside of this country. I don't know any politician in Elgeyo Marakwet County who is going to go to the county facility there for treatment. They'll be on the next flight out to Nairobi hospital. Okay? And if that's what's going to happen, how do I...
Even you doctors,
yes,
when you get sick,
yes,
like you work in Kenyatta,
yes,
when you get sick, you don't go to Kenyatta, you go to Nairobi hospital. Why?
No, we don't.
I've seen a director of Kenyatta, I don't want to name him,
yes,
who was sick.
Yes.
Instead of going to Kenyatta, director,
yes,
he went to Nairobi hospital.
That is true, and that should make you ask yourself why. Why aren't we doing anything about these facilities? Look at the previous 2 strikes of the doctors that we have had. We expressly addressed the issue of the rot in the public facilities. They don't have anything, they don't have resources. Even in Kenyatta National Hospital, that general patient admitted in Kenyatta National Hospital, right up until 4 or 5 years back when Kenyatta National Hospital had a CT scan machine, still had to be taken by Kenyatta National Hospital to have that CT scan done outside of Kenyatta. Okay? So it's not if you have choices, I will tell you something. At my level and age as a doctor, I will not be able, even with my pay, I will not be able to afford Nairobi Hospital. And if you see me in Nairobi Hospital, it's probably because I have a spouse who's working in a different institution, who is actually able to have medical cover that as a beneficiary, I get treated in Nairobi Hospital. Okay, so when you see these people who are going to Nairobi Hospital, majority of them are under insurance. Take that insurance away. I promise you, only 1% of Kenyans will be able to afford that. All right, and because of that, the doctors, if you go to the districts, get treated right there. Their wives deliver in those district hospitals, taken care of by their own colleagues. And I will tell you something, in the smaller districts, the private sector facilities there are not any much better than the government facilities. It is the issue of the ability of the people to pay. So if you are, for example, in Tana River district, even if you put up a lovely facility like you would have here in Nairobi, nobody will afford you, isn't it? So how do you expect such areas to actually be able to attract doctors, nurses, clinical officers, radiotherapists, highly skilled workers to actually want to go and work in those facilities? The only hope we have got is to ensure that the public facilities are able to provide this service. And if we're going to do that, as much as we bring in the machinery we need, we bring in the drugs we need to retain the expertise. And the expertise will only feel safe when they know that they work under a structure. That's all we're asking for. I don't think that's too much to ask.
Just taking more questions. Kamau from Mathare, that was a reality check there, very important. But Kamau from Mathare says, shame on you doctors, lovers of money with no humanity. Want to respond to that?
We have had that a lot. We're no longer surprised. Even the patients, when they're on their deathbed, they still call us names. You have to be able to rise above that and continue to do what you are doing. But I would like Kenyans to also remember that as much as people call healthcare a calling and all that, we still have to pay the bills. Kenyan Power will not stop to disconnect my power because I am a doctor. Okay? And when you hold the title doctor, the very same society that's very quick to judge you now is the very same one that expects you to contribute to their harambes, to help their children go to school because of that title. Okay? And I think as much as we talk, I think some of what the public needs to also seems to forget is that it's not just doctors on strike. It's nurses, it's clinical officers, it's lab technicians, it's pharmacists, it's drivers, it is even telephone operators in these facilities. All these people must work together. Okay, it's not about one. So we have to also be able to protect all these people. I will tell you that I don't think there's a bigger calling than being a nurse. Even I don't even know how many people in this country will be able to take care of their spouse 100% when they're bedridden, that they'll give them a bedpan, that they'll have the patience to feed them. This person who'll go out of their way to do this for your family, please protect them. Don't point fingers and judge them, because once they are done taking care of your family, they still go home to children who wait to be fed, who wait to have school fees paid. They need to be assured that they should be able to continue affording to also give service to their families. It's not just service to the public. But if you go to
district hospitals, you find that the management of them is horrible. The MOH, for instance, is the one who has a clinic outside. That Nairobi place was saying.
Yes.
The MOH of some district hospital is having a clinic outside. So the patients will go to this place first, then you take them to the district hospital. The pharmacist has his own chemist in town, sometimes stealing the drugs from the hospital and selling them there. The nurse at the clinic officer has their own, with the name of a doctor so-and-so, but the only clinic officer there, or a nurse. So, in fact, I went to one of them, and you've seen grass. It's a hospital, surely, or the sheets, bed sheets, they are yellow or whatever color, but they are not white. They're supposed to be. The grass is up there. And because nobody's interested in that hospital, not because they are not paid, but because there are other interests outside in the town. The hospital is there. They just go there to check the patient, and you can see a patient. The patient sleeps with the relative so that they can feed them, not the nurse. When they shit all over, the people who come to see them, they're the ones who clean, not the nurses. And that description is very legitimate. Tell me why that happens.
Okay, first of all, a few misconceptions there.
Number
one, any clinical officer, nurse or doctor by law is allowed to own a private practice.
Yes.
Okay.
The commission did allow them.
Yes.
It's true.
That is allowed, so you cannot blame them for having these facilities. Number two, whatever happens inside of the hospital, as you're saying, those bed sheets you're complaining about, we complain about them too. It is not us who give the funding for the services to take place. If there is no money to cut grass, you can't blame the MOH for that, because it's not
there are workers there employed, they have slashers there, but they don't do it.
How many of them?
They're there. Even if it's one, at least cut somewhere.
Because every facility actually has to collect what they have been calling facility improvement. For that's how it's been working in the past. That what we call the cost sharing. That little money is the one that has been hiring these casuals to do this kind of work. Now, when you come from an extremely poor county, don't forget that 3/4 of those patients don't even afford to pay the fees for those hospitals. And you have seen this in the press before, when the press come to a facility and say we have 70 mothers detained in hospital because of non-payment of bills. And what happens? A politician walks in and all these people are released because they cannot afford to pay. Who gives that money back to the facility for its improvement? There is no one. Okay, now we talk about saying that the patients are being taken care of by their own. That is actually illegal. But you know what? When you have 170 patients and 2 nurses, what do you expect? Would you rather the patient starves to death or the relative comes to help to feed the patient? These are the things we're talking about. Look at our ratios in this country. We've talked about this over and over and over again. If you have 1 nurse for 50,000 people, it cannot work. Because if the WHO recommendation is far, far, far from being met, those nurses will come to work every day and will experience total burnout. It will reach a point that the nurses are so few, they're actually told you cannot go on leave, because if you go, the shortage you will create, the hospital will close down. 2-3 years accumulated leave days. Somebody has never gone on leave.
But they always are in other places doing something called locum.
The locum is to keep people alive. But if you look at places, as I said again, for you to locum, there has to be a facility for you to locum at. Now, in those counties you're describing, there is even no facility that is worth giving you any locum for you to say that this is why I went. So what do they do? Just like any other person in business, you will put a Sukuma Wiki stall outside there and sell your vegetables. That doesn't require you to be there. Because for the longest, the public has had this mentality that people run away from public facilities to go and make money in private so that they can, I mean, because of that, they actually don't care. I will tell you something. A long time ago, we used to have what we used to call amenity wards in the public facilities. And this is where the doctors working in the institution, instead of taking the money out of the institution and admitting their patients to other private facilities, the amenity wards were like an income generating venture, such that these doctors would actually admit their patients to the same hospital. The bills are paid because it will definitely be like a private facility, and that money helped these facilities to stay afloat. Now all those were closed. Currently, amenity facilities are only available at Moi Teaching and Referral Hospital and Kenyatta National Hospital.
Why were they cancelled?
Because, as you said, the same claims that the doctors are corrupt, they want to take their patients to amenity to make money and all that. The doctor would take his cut, and this is an agreement between you and the patient. If I tell you I'm going to charge you 30,000 shillings for a cesarean section, you do have the right to say no. But you know that the extra bill you'll pay is to the hospital, it's not to me. It's for the drugs you used, it's for the use of the hospital, where the nursing care and all that. That money remained for the improvement of the facility. So once these were all removed, facilities now have to depend solely on what is coming in from the government. I will tell you for a fact, a normal delivery in a dispensary here in Nairobi has been costing 20 shillings. 20 shillings is not even enough money to autoclave the things you used just for sterility for the next patient, which means that the government has been bearing a huge burden to provide almost free service just for the sake of the patient, the poor patient, to have access to health care. This gap is not being effectively bridged. All right, we see our health budget every year, 5-point-something% of the total. I mean, we have a population that's exploding, and you're still giving the same amount of money